Hello, everyone. I have a wonderful patient of mine. She is 6 days out from her explant. She had 375 cc's and implant below the muscle. And let me ask you this. How was your anesthesia experience?
Wonderful.
Do you remember anything from the surgery?
Nope.
Okay. Number two, how's your pain now?
My pain is good. I have not taken any pain meds today.
Okay, good. Now, I want to let everyone know 2/3 of my patients, now I say this to you, don't listen to me, listen to my patients. 2/3 of my patients, usually around this time, are taking Tylenol over the counter or NSAIDs, depending on the regimen. A third, which is still a good number, right, are taking the pain medications, Tramadol, Norco, Percocet, whatever we have discussed. So it is not uncommon, but a lot of my patients are doing well. Now, as you see yourself, do you think you need a lift?
No.
No. So
No,
this is
they look
very
great.
important. Yeah. Now, if you can remind us, how old are you?
I am at 37.
37. Now, clearly, as you will see, and you had 375 cc's, relatively speaking, large implants, right?
Yeah.
Now, did you need drains?
No drains.
No drains. And so this is what I say, consistently. And there is no reason for a lift, no reason for a drain in the vast majority of the patients. Now, there are some patients that I look at and say, you'll likely be a candidate, but this is not the right time. This is not smart time to be doing cosmetic surgery when the whole 4-hour surgery or so is devoted into removing the entire capsule plus the implant plus all inflamed tissue. Now, next question for you. What have you sought improvement in your post-operative recovery?
Instant. I don't want to say instant. Within 2 hours after surgery, I no longer had any nasal congestion. I did the before and after pictures, which were really fun. All the facial swelling was gone. I could barely lift my eyebrows up, and I had a lot of inflammation in my eyes. All of that is gone. And that was improved. I live 2.5 hours from here, so that was improved by the time I got home. And then the next day, within 24 hours, it was even better. So, and I have also lost about 5-6 pounds already.
Wow, and this is the inflammation, right?
Yeah. I'm drinking lots of water, eating normally.
Your face looks different, your eyes look different, your overall body, and this is where every person, every patient responds differently depending on the implants and their overall how they were affected. Look, there are some patients that I talk to 20 years later, they come back and say, now I'm starting to feel the hurt. There are some patients that I talked to this weekend, for example, just 2 years into their augmentation, they were having problems. Now, you would expect, someone young to at least, quote, have them at least 7-10 years before they would start becoming reactive. Now, please tell us about your course.
I've had my implants for 3 years. And
Wow.
I started having symptoms, probably my first sign of symptoms were about 2-3 months into it. And then didn't see anything for a long time. And then about 6 months after that, I had, it was just one day I came home from work and I just couldn't function. I had a lot of cardiac symptoms.
What were those cardiac symptoms?
I had tachycardia.
Which is increased heart rate.
Yeah. My heart rate would get in the 130s to, I'd been in 170s before for no rhyme or reason. I'm just sitting there. I too am a nurse, so I'd just be doing patient care, and all of a sudden my heart rate would just excel, and then it would come right back down, and nobody knew why. All my specialists.
How many specialists did you see?
I had a neurologist because at one point they thought I had MS because it only happened to the left side of my body, mind you. I would have facial numbness, not really paralysis. Like I could smile and I still had, symmetry, but I couldn't feel anything on that side of my face. I would feel like I was having a stroke. When I would have cardiac symptoms, I would get shooting pain down my left arm.
Wow.
I would have chest pain as if I was actually having a heart attack. I've went to the hospital several times. It's kind of the key thing, right? All your tests come back fine. So I've had a cardiologist, electrophysiologist, I've had a neurologist, and I've had all the tests, and everything came back okay. So my story really started because I have a really good girlfriend who had breast cancer, who had a double mastectomy. And she called me one day and she said, hey, the doctors won't let me get breast implants. She doesn't live in Michigan. She lives down in Florida. and she said they won't let me get breast implants. They said there's a lot of women reporting that they're having a lot of symptoms from them.
Wow, that is huge.
Yeah. So I started researching, and me being, medical background, I have been researching for about 1.5 years on this. I feel like I know it pretty well inside out now. And that's how I found out about it. And I thought, what is happening that they won't put implants in a woman who just, had hers taken away, her breasts, that's a big deal. Your image is a big deal to us. We wouldn't have this done if it wasn't. And I said, what do they know that I don't know? So I started researching, and that led me to Dr. Khan. Obviously, he has great reviews. I can't be more pleased with what I just went through. I mean, my recovery's been great so far. I have not had any symptoms. I have not had any symptoms. I can say that. I've been
and time will
great.
be witness. You're just 6 days out. Now, I will tell you, I talk to a lot of ladies. This is where they say when they listen to these stories, it gives them hope. Not only to the patients, but I'll tell you to the significant others, the other family members, because they say, what are you talking about? Implants are still very much safe. They're putting them in at the top institutions, not only in the U.S., but in the world. But I'll tell you, you just listen to the FDA, you just listen to the manufacturers, and you listen to the patients, you will run.
Well, Dr. Khan, I went to my plastic surgeon that put them in before I saw you. I actually saw you in the same week as that. And I had went there because I was so sick, and I asked about getting them out because I had found all this research, and I had stated that, I don't know what else to do. Like, my doctors don't know what's wrong with me. My tests are coming back fine. This is the only thing that I have done different to myself. And I mean, unfortunately, my doctor had said, there's no way this is making you sick. And for me, being a nurse, you have to be your own advocate. I tell all my patients that. So you can't stop. Be the squeaky wheel. Keep going.
No, very well said. If you just listen to your words, 3 years later, and had you not had I'll tell you, this is as sincere, as pure as you can see. None of these patient testimonials are rehearsed. This is pureness from your heart to the other patients. And again, I am just serving as the middle person so that you can connect not only with the many ladies in the U.S., but the rest of the world. Almost 1 million women in the world get implants every year. That's pretty much plus minus the average. So now a little bit less because of the awareness that you're bringing forth. And now as you live the rest of your life, you have nothing to worry about, no fear, your pathologies are remarkable, your cultures, everything is looking reassuring, and you have freedom from the toxicity and only a better quality of life.
Yeah. And I thank you.
No, you're welcome. Again, thanks. Thank you so much.
I thank all the women out there who have shared their story.
Yeah, that is also very important. For me, if you look at my personality, I'm the last person who would go on social media, but I said, it is my responsibility, and I appreciate your leadership in all of this for coming forth and discussing and sharing your journey, because it is the women movement. It is the movement by the women for the women, essentially, right? What you said, there is no plastic surgeon that's going to talk about it. There is no primary care doctor. Now, I congratulate that doctor who stopped that breast cancer patient from getting implants. That is huge. And I congratulate the women that talk to each other and are propelling this. And I'll tell you, this is what is going to inevitably lead to a ban to the implants, hopefully saline this time as well, along with silicone implants.
Yeah, it's real.
Yeah. Now, thank you. Thank you very much. God bless you. Thank you.